Okay, let's unpack this. We're diving into one of the most vital messengers in your body, cortisol, the stress hormone.
Right.
And this deep dive is a bit different because we're not just looking at the science. We're using material from Blood Test UK to see how something as simple as where you get tested can change everything.
That's exactly the mission today. We're looking at the practical side of managing your own health, and specifically why local access is so important for a cortisol blood test, using Stockton-on-Tees as a perfect example.
So let's start simple. What actually is cortisol?
Well, in simple terms, it's a hormone your adrenal glands make. Think of it like your body's built-in alarm system.
It handles your fight or flight response, metabolism, that sort of thing.
Exactly. And the key thing, is its rhythm. Cortisol levels are supposed to be highest in the morning, right when you wake up, and then they fall throughout the day.
And that rhythm is why the testing is so sensitive, isn't it?
It's everything. I mean, if you're stressed from traveling for an hour to get to a clinic, that can mess up the reading. The test itself is critical for diagnosing conditions like Cushing syndrome.
That's too much cortisol.
Yes, too much. Or Addison's disease, which is too little. It helps explain symptoms that are otherwise, a bit vague, like fatigue or sudden weight changes.
Okay, so beyond feeling tired or seeing the number on the scale change, are there other more specific signs? What do the sources say to look out for?
They absolutely do. With low cortisol, so Addison's, you might get really bad muscle weakness, low blood pressure, even mood swings. And with high cortisol, with Cushing's, it often shows up as skin that bruises easily, muscle loss, and very distinctive fat deposits. If you have those symptoms, this isn't a routine check anymore. It's a critical diagnostic.
And that brings us right to the main point here. Location, location, location. The sources from Blood Test UK really emphasize how local access changes the game. They point to Stockton-on-Tees having, great healthcare tech and experienced staff right there in the community.
And that is the big takeaway for everyone listening. Local access means less travel, and less travel means less stress.
Which means a more accurate test result.
Exactly. If you're already dealing with fatigue or it's hard for you to get around, a local clinic, whether it's NHS or private, is a huge advantage. The result is much more likely to show your true baseline, not the stress of the journey.
The sources also suggest that local facilities can give more personalized care, right? Because they understand the community better.
They do. Now, about preparing for the test. You have to schedule it for the morning. That's non-negotiable because of that cortisol peak.
And you might need to fast, too.
Yes, you may need to. Food can affect your blood sugar and hormones, so you have to follow the rules exactly to get an accurate reading.
So moving on to the benefits. Let's say the test does find something, like Addison's or Cushing's. Early detection makes a huge difference.
It's life-changing. A quick diagnosis leads to quick treatment, and that dramatically improves a patient's quality of life.
And even if you don't have a serious condition, just knowing your levels helps with general wellness, doesn't it? It can help you manage stress and anxiety before they really take over.
Absolutely. Understanding your baseline is just good, proactive health management.
Now, on the practical side, the sources mention a cost for private tests, somewhere between £50 and £150. Why such a big range?
That usually depends on whether it's just a cortisol test or if it's part of a bigger panel of tests, and if a specialist consultation is included.
Okay, that makes sense.
But it's so important to remember that NHS options are often available for eligible patients. The experts cited by Blood Test UK really recommend routine testing for anyone with ongoing chronic fatigue or, weight changes they can't explain.
So the key takeaway for you listening is that local cortisol testing, like the kind they have in Stockton-on-Tees, it isn't just a nice to have, it's essential for accurate, proactive healthcare.
It is. And that leads to our final thought. The local experts say that if you're having symptoms of a hormonal imbalance, checking your cortisol every 6 to 12 months might be a good idea. So the question is, are you paying enough attention to the subtle signals your body is sending about stress, or are you waiting for them to get louder?